Hello, and welcome to another episode of Rational Nuggets. My name is George Bekmezian, and I hope you're prepared to be infused with some rational thinking. I have been getting a lot of questions and reading a lot of comments online about treatments, medications to use for COVID-19. Even though there is a lot of controversy out there, what we're finding out today, and I'll just jump right into the too long, didn't watch version, there is nothing that is proven in a controlled trial, double-blind study. The medications that I'm hearing talked most about in my circles are Ivermectin and Dexamethasone. Ivermectin is an interesting one because it was part of that study that came out back in May that kind of derailed the hydroxychloroquine debate because they said that it was this large multinational study, and we've talked about this study. It was published in Lancet, and then after more scrutiny, that study was pulled. Well, come to find out, that study had also covered ivermectin and had put it in a positive light. Even though that study was retracted, it did a lot of damage. One, again, it derailed hydroxychloroquine studies and research that was going. Second, it led to a number of countries changing directions and moving to the use of that medication. There's an article in The Scientist that I will, of course, have in my description below. And that article states, I'm going to read that, on May 8th, Peru included ivermectin as a COVID-19 treatment in official clinical guidelines. And then on May 12th, Bolivia approved the drug's use for COVID-19 patients who consent, and later started handing out hundreds of thousands of doses to residents. So there's an unproven drug that was covered in a demonstrably flawed study that was published and supposedly peer-reviewed, and it had a lot of consequences. Additionally, by early June, according to the article, at least one municipality in Brazil had endorsed the use of ivermectin as a preventative medicine for COVID-19. So no good research, but here we have multiple countries, and there are others that I'm not covering right now, who made the shift and approved ivermectin. And a lot of this happens because of the idea of compassionate use of drugs. I think it's a good idea for us to quickly cover the idea of compassionate use as well as off-label use of medication. What off-label use of medication is that when there is a medicine that is designed and approved for use for a particular condition, then the FDA again has approved that medication and a doctor can prescribe it anytime. Well, off-label use is that same medication being used for something that it wasn't approved for, that it isn't validated or proven to work for. And it's a common practice for doctors to prescribe medications off-label. Compassionate use of medication would say that if there is a pandemic, like we're in the middle of right now, and people are dying, and the prognosis is that they're going to die, that this is very critical, and we should do something, even if we don't know whether that something is going to help. Because that something, theoretically, is unlikely to make it worse. Well, you judge for yourself whether this particular illness, COVID-19, justifies that type of risk, especially when you consider that there is a controversy about exactly what the point is, but it could be anywhere from 99.96% to 99.5% of those who are diagnosed are going to get better. So does compassionate use of treatment in these cases apply? Is it a good idea? Now, I would argue that for people with serious comorbidities that are at high risk in the class, that there's a higher mortality rate, then potentially compassionate use could make sense. But when we talk about those things, we're beyond rational thinking, and now we're into emotional thinking. It's really hard to objectively quantify emotional thinking. So I would say that that is a little bit out of scope of this conversation. Now to ivermectin. What do we know about ivermectin? Frankly, not a lot. What we do know about ivermectin is that it has been effective in testing in vitro. Also, what we know is just because something has been effective in vitro does not mean that it's going to be effective in vivo or in humans or other animals. The results that we have from the in vitro studies is that they actually used doses 10 times greater than that approved by the FDA. And there's a good chance that based on what I've read, the dosage being used is going to be toxic. Yes, there are a lot of people swearing by this medication in the world. It's actually interesting because ivermectin seems to be politically the global equivalent of hydroxychloroquine here in the States, meaning that there are presidents and leaders and medical professionals in other countries who are swearing by this medicine, even though they don't have any real hard scientific evidence to justify that. The other really hot medication right now that is making its rounds internationally is dexamethasone. And this article is titled Dexamethasone and the Recovery Trials High-Speed Science. In just 3 months, one British research team identified the first life-saving drug of the pandemic. That's pretty promising. First life-saving drug of the pandemic. In the middle of this trial, the research team decided that the results were so convincing that they couldn't keep moving forward without a press release providing an update on the effectiveness of this drug. And I agree, according to this article, it says technically that's not the way science is supposed to work. We don't interrupt studies and have press conferences. As a result of that press conference, UK's National Health Service added dexamethasone to its COVID-19 treatment protocol. Politics and science mixing, even though we don't have validated results. During this press conference, they stated, quote, "Do I hold on to that as our little secret whilst patients are being treated with no evidence at all, either by not being given any drugs or all sorts of drugs? Do I hold on to this information?" And then he answers his own question and says, "The answer is, you're cursed if you do and cursed if you don't. But by far to me, the better option was to make the results publicly available." So you might be asking at this point, okay, so what are the results of this that were so compelling? Let me tell you. Before I do, let me explain to you that this medication is a steroid. It's actually most effective in the later stages of the illness. Also, this medication is cheap. According to the article, it says that it is $10 a pop. Also, like the hydroxychloroquine arguments, they say that it's a well-known drug and the side effects are also well-known. In the preliminary report of the study titled Effect of Dexamethasone in Hospitalized Patients with COVID-19, they report, based on the results, 1 death would be prevented by treatment of around 8 patients requiring invasive mechanical ventilation or around 25 patients requiring oxygen without invasive mechanical ventilation. What that means is that nearly 13% of those who would have otherwise died will be saved by this medication. Again, of those who have been intubated. But of those who are receiving oxygen but not intubated, about 4% of those, according to this research, would be saved by dexamethasone. The potential life-saving of this medication in late-stage illness was compelling, and so they released the numbers. Again, this has not been peer-reviewed, and the final results of the study have not been published yet. So this is an interim update. We've talked about ivermectin, we've discussed dexamethasone. The other supplement I wanted to talk about today is zinc. Zinc has been in the news from the beginning. It's been controversial because it has been associated with hydroxychloroquine. However, zinc doesn't necessarily need hydroxychloroquine in order to be effective, because what zinc is doing is it's protecting your cells from being infected in the first place. There's a long history of zinc being effective against a lot of different viruses. What we're finding, though, is that zinc needs an ionophore. And what that means is that it needs a substance to allow the zinc ions to pass through and be absorbed by your blood. There are other options besides hydroxychloroquine that are potential ionophores that could be effective for zinc. And why do we think that zinc would be significant, you may be thinking or asking? Well, there's a published article titled, "Does Zinc Supplementation Enhance the Clinical Efficacy of Chloroquine, Hydroxychloroquine to Win Today's Battle Against COVID-19? I'm going to read this line here, and it says, "Zinc is a general stimulant of antiviral immunity. In the context of COVID-19, zinc deficiency may be relevant for the outcome of patient populations with severe clinical courses of COVID-19, including elderly patients, patients with hypertension, diabetes, coronary heart disease, or chronic obstructive lung disease." In other words, they find zinc deficiencies in people who get really sick. Again, not enough research to know if this is a causation or a correlation. But what we do know is that zinc has been effective as an antiviral against other viruses. As an example, here's an article titled, "Zinc and Respiratory Tract Infections, Perspectives for COVID-19." And this is published in April of this year. It says, specifically, zinc in combination with an ionophore were shown to inhibit SARS coronavirus activity by decreasing its replication. These important findings demonstrate that zinc may be considered as the particular antiviral agent in COVID-19 treatment. Again, we have these little hints here, little hints there, but there's nothing conclusive. The nice thing about zinc is that it's a supplement you can go out and take right now. There's no harm. Take dosages that are safe. You don't need to wait for approval from anybody to do that. Just go do it. One final zinc research I wanted to share with you, and this one is titled, "A Randomized Controlled Trial of Zinc Supplementation in the Treatment of Acute Respiratory Tract Infection in Thai Children." So Thai meaning Thailand. And this was published on May 23rd of 2019. So over a year ago. But what they found is that acute lower respiratory tract infections were stopped faster in children who received zinc supplementation. And by faster, it was 3 days versus 4 days. So you might think 3 days to 4 days isn't a big deal, but it is actually a 25% reduction in the length of time these children were sick with this virus. Additionally, in this study, they found that their hospital stay was shorter as well. So 3.8 days versus 6.1 days respectively. What that means is that for this lower respiratory tract infection, hospital stay for these kids in this study, in which was a controlled study, the children who were taking zinc had a hospital stay 48% shorter than those without zinc, so in the placebo group. That is a significant difference. Again, this isn't coronavirus, but it is a respiratory tract virus. And so there might be some crossover relevance between this study from over a year ago and coronavirus today. It will be wonderful if we can have this type of study happening today. But here's the problem. These studies are getting more and more difficult because they are running out of patients. In a Wired article titled, "Want a new COVID-19 drug fast? Bring on the battle royale." In this article, they state, the biggest limiting factor with these types of trials is usually that there aren't enough cases because outbreaks are very unpredictable. They start and stop. Different areas are hotspots. That's why a bunch of COVID-19 drug trials in China have stopped before getting any results. They ran out of patients. The same thing happened with those trials of an Ebola vaccine in the 2014 West Africa outbreak. Basically, we don't have good enough data to compare new therapies. I've talked a lot about medications again today, and what I don't want to do is lose sight of the fact that the vast majority of people who are infected with COVID-19 are going to get better. There is reason for us to be optimistic. So please get out there and carry on with your life. Be smart, be hygienic, try your best to get back to normal. If we don't get back to normal, the damage that is being done to emotional health of people, to marriages, to relationships, to the economy. I know that a lot of people think that it is insensitive to talk about money when people are sick. But remember that people are sick and dying because of the consequences of the pandemic reaction. We need to get healthy, not only from the illness, but from the effects of the response to the pandemic. Please feel free to respond below if you have any questions or comments about this. I invite you to subscribe to the channel and share, and feel free to look at some of the other videos. The video about masks is relevant. Thank you. I'm out.